I do see that we're kind of on the other side of the tunnel, if you will, in terms of CDMO capacity in the cell and gene therapy space. I've been managing outsourced manufacturing, both in the cell manufacturing side as well as the vector side for a number of years. And I think that in just the last year or a year and a half, things are looking a lot better, in large part because CDMOs have been building out a lot of capacity in the years prior, either based on their own market analysis or driven by specific clients, looking to expand out. I think that I experience very much so on the cell manufacturing side, where it's dependent on clients with specific needs on scale out capacity, making those investments, and whether those investments have kind of panned out into realizing market demand or whether that market demand has fizzled, I think is adding to that surplus. I think Joe raised the point around where things are with the overall economy, and so you're now looking not only on an increase in supply, but the demand itself is, I think, going down. Fewer companies are, I guess, able to raise funding in this environment, and as such, the ones that are able to persist may be postponing significant investment or very costly campaigns in the hopes of, I guess, seeing brighter days down the road. Ken mentioned process intensification, right? I think that a lot of the processes that we're working on, especially on the vector space, are getting better. Higher productivity, more scalability, which is in turn having a benefit from a capacity demand perspective. And so I do think those are all very real. I will, I guess, flip this, and I do hope that we can come back to this down the road. I think that supply chain constraints are still very real. So even if you're finding capacity at CDMOs, it doesn't necessarily make it straightforward to get in and start manufacturing your batches without kind of building in the ordering and process well in advance. The other major constraint that I think has not abated is actually on the analytical side, right? A lot of CDMOs are heavily dependent on outsourced testing. Some of the more advanced ones have internalized a lot based off of, having a desire to meet client demands, turnaround times, and rapid release. But there are a number of assays that continue to be outsourced. And from my perspective, these are becoming the most significant bottleneck in terms of, yes, you might be able to produce a batch, but if you can't release it, ultimately you're kind of beholden to those realities. So again, I think we're on the upswing from a utilization perspective, but there are still other factors to consider.